You're watching ASH News TV, and I'm joined now by one of the co-chairs of the Special Symposium on Quality, Dr. Lisa Hicks. Why don't you give us a little recap on what was discussed here today?
Sure, happy to. So at the Quality Symposium today, we had three speakers. The first speaker, Dr. Helen Bernstein from the National Quality Forum, spoke about the landscape of quality really and how quality metrics have been developed and how they can be used to improve quality of practice, and then specifically about pay for performance and how that can be used. We then invited Dr. Andrew Ryan, who's a scientist from the University of Michigan, and he spoke about a little bit more of the background and also some of the evidence. Both he described it as the good, the bad, and the ugly. So some of the background and evidence that both supports and in some cases doesn't support pay for performance as a change strategy in improving the quality of care that our patients receive. And then the final speaker was Dr. Tefera from CMS, and he talked about some of the really important and major changes that are going on within CMS in terms of how physicians and organizations are remunerated, and how CMS is really aiming to shift remuneration towards tying remuneration more and more to quality metrics and quality of care, which I think is a very laudable goal, but has some challenges.
And it's no longer a theory so much anymore, you were saying. It's more about this is happening and it's going to need to be implemented. So what are some of the challenges with that, and how do we hope to overcome some of that?
Yeah, I think if ASH membership need to know one thing, it's that this is not theoretical anymore. This is happening. This is real time. The CMS is changing how physicians are remunerated. It is, I would say, very much in both physicians and patients' benefit to learn more about this, to learn more about quality metrics and how to use them to improve care for patients, and along the way, how that will impact the structure of their practice and their own personal remuneration.